Hey folks, we're back and I'm your host, BKP. We're at Circuit World here in Blue Ridge. Beautiful morning.
Great day, isn't it?
Beautiful morning. Here with Dr. Whaley. Want to thank North Georgia Cancer Specialist, affiliated with Northside Hospital for this segment. How are you doing, sir?
I'm great. Yourself?
I want to do one more thing. I want to say hello to Keith.
All right.
I don't think you know Keith, but Keith watches you every Friday. Yeah.
Morning, Keith.
So I got to say hello to him.
You want to know why I'm wearing this
That's
wilted flower
what I was
here?
going to say.
We're not talking about the Thai wilted flower. Yesterday was the National Doctors Day. Hospitals all over the United States, Canada, United States and Canada celebrated Doctors Day. And last night, Fannin Regional had a reception for the doctors, and I went over there, and I figured I would bring my old wilted flower in here and say thank you for remembering your doctors, sir.
Yesterday was National Doctors Day?
National Doctors Day.
Okay.
Yeah. And you heard it first here on National Doctors Day. 2 weeks ago, I told you about the epidemic of measles. And this week, you heard that they took a whole county in New York, 90 miles from Manhattan, and banned all children who have not had a measles vaccination from any public park, from any public space except public parks. So they can't go to school, they can't go to church, they can't go to a grocery store. And they have a huge epidemic of measles there. I think they've had 180 cases or something like that. So go get your measles shot, take your kids to get their shots. There.
So if they're not, I don't want to gloss over the rose or the tie, because you always usually have a story. But I know today you're wearing your Randy Travis World Tour jacket. Maybe I should have said it, but I love it.
Okay, yeah, this was.
I wish our folks could see the back.
Yeah, I got a whole closet full of these things. It's a funny story, but I knew that yesterday, in my office, I have a patient who is a musician. Hasn't been able to work for about 4 years for malignancy, and I had noted he was going to be in yesterday. So I put this jacket on, and I wore it in there in honor of him yesterday. Of course, I wear a white coat in the office.
Right.
So I had him take it into the examining room and hang it over the back of my chair so that when he went in the examining room, this would be hanging over the back of the chair. It gave us something to talk about. The guy's real sick.
This is personalized. This says Bill, almost like you know the guy.
Yeah. It's a long story. Yeah.
All right.
We got to talk about cancer.
All right. Okay. Yeah.
One of these days we'll do a whole session on country music.
Considering we can't talk about, Braves fans don't want to talk about the Braves today. We'll have a medical question. How about that?
All right. Good.
All right. Our first question today. My mother has had colon and breast cancer. She now faces a nodule in her lower right lung. Doctors say it is definitely cancer, but are not sure what type. Lung cancer and metastasis of colon or breast. Is a lung biopsy the only way to find out what kind of cancer it is? Sorry for butchering that.
You did perfect. So basically, the patient has a prior history of breast cancer, has a prior history of colorectal cancer. That is not the least bit unusual. I had a patient in the office yesterday who has had breast, ovary, and colon. So you can have multiple prior cancers. The things we don't know was the length of time from the diagnosis of colon cancer and breast cancer. Secondly, we don't know whether the colon cancer or the breast cancer was locally advanced or very early, whether they did or did not receive any treatment. But if you'll show that first picture there, Josh, this is a chest x-ray, and you don't have to be a rocket scientist to know that there's a bump on one side that you don't see on the other. Now, it's only been a week or two since I was telling you that your right hand should look like your left hand, only a mirror image, and your right eye should look like your left eye, only a mirror image. And if your mammogram had a spot on one side that wasn't on the other, even if it didn't look like cancer, it wasn't supposed to be there. So we would show me the next one, Josh. So even though it didn't look malignant, we would have to go after that bump on the mammogram because it wasn't symmetrical. You remember that?
Mm-hmm.
Okay, so this is not symmetrical. Go to that chart there that's got that picture. Okay. So this is what he's showing you here. I brought it here because it doesn't show real well in the black and white.
Lung nodule
causes. Okay, well, only one of these here is metastasis from other cancers. Up in the left is infections. Last two I've seen this week that have been biopsied last week, while I was out with my hip replacement, by the way, were infection. One was inflammation from rheumatoid arthritis.
Right.
So some of these can be scarring left over from I was raised on a farm. I've inhaled stuff in the chicken house or whatever, or I was in Vietnam with me and got something else. So only one of these 5 will be malignant. Now the question is, clearly you have to sample it. So I think this patient here, it was really onto something. Show me the next one there, Josh. Which one is the next one here?
It's the flow chart.
Okay. Now, this is why you have to do. Now this is going to confuse people. I just want them to look at it. But you've got to get a piece of this in some fashion. And there is a brand new, I think just not 3 or 4 months ago, I talked about liquid biopsies. There had been a question about, was there a blood test to diagnose cancer, if you'll remember. And I said, well, PSA for prostate cancer and the tumor markers, but there are experimental tests that actually pull DNA out of the blood and can identify malignancy. Well, as of the last 12, 16 weeks, this has gone from experimental, has gone to prime time and is available. And that is a blood test where they can look for all of these different, just confuse you, but every one of those things is a different genetic marker. And they can identify not only the malignancy, but what the genetic driver is that's making it go. And as I've said before, frequently that'll allow you to treat it without using chemotherapy. So the first answer to the question is it has to be sampled in some fashion. The second answer to the question is if a liquid biopsy is done and this is lung cancer, it's got about a 95% chance of identifying it as lung cancer. If it's colon cancer, it very well may not identify it, and a needle biopsy would be required. Now show that last one there, because we're putting this thing up, BKP, but there are 3 of these, and every one of the things on the left-hand side is one of these genetic markers, and everything along the top-hand side is the different tests that are done to make the diagnosis. And all except one of those columns requires that you stick a needle into the nodule to do the test, and only that one right there, which is circulating tumor DNA, that one column would be able to be done by the liquid biopsy. So mama does need a needle biopsy if that liquid biopsy can be done and is not diagnostic. Second, the liquid biopsy might not be paid for by your insurance today. You would have to argue with, many insurances pay for it right off the bat. Medicaid, I think, does not pay for it. Many insurances do not. So the answer to the question, it's got to be sampled in some fashion. Yes, there is an alternative if it's available in your location where you are and if somebody will pay for it, and that is the liquid biopsy. 6 months from now, the cost of the liquid biopsy, which was about $25,000 a pop when we were talking about it a year and a half ago, was about $1,500 a pop 3 or 4 months ago. It's like $600 a pop now. So it's coming down like the cost of LASIK surgery. See that ad last week? You can get a LASIK surgery done for $250 an eye, and it used to be $3,000. So if you ask me this question again in 3 or 4 months, the liquid biopsy will probably be available for everything. So you got to do something, and the liquid biopsy, if it's available, step one. If it's not paid for or it's not diagnostic, stick a needle in it. There you go. Enough?
That's enough.
Is that enough, Josh? All right.
Okay, and again, we thank Georgia Cancer Research Specialist affiliated with Northside Hospital for this segment. And our next question I am a male in my early 30s. I'm a male in my early 30s. I am very active daily and have no other health problems. Recently, I've noticed I am sitting in my vehicle or on my motorcycle. My arms go numb, starting with my left arm tingling and then becoming very numb. What could be causing this, and what can I do to correct this?
Well, first of all, we're going to go through this. Is common things are common, right?
Right.
Is that right, Josh? Now, what's the next thing they tell you? Of course, you didn't take a lot of. You probably didn't take a whole lot of physics or mathematics or anything. So, the next thing is when you hear hoof beats. You know what the rest of that statement is? When you hear hoof beats, you think of horses, not zebras. And in medicine, when they talk about something being a zebra, they mean that it's an extremely rare thing. So, we're going to begin, first of all, with a healthy man in his 30s who's very active and whose hands go numb when he is riding his motorcycle or when he is sitting in his vehicle. I want both of those portend something that is positional. When he's sitting in his vehicle and his hands are on his steering wheel, they are like this.
Mm-hmm.
If he has a motorcycle, I'm going to predict that he has high rider bars rather than down bars, and his hands are like this. Okay, go to the next picture. Assuming that I am correct, which I may not be, what he probably has is bilateral carpal tunnel syndrome. So this is a picture of the wrist. And you got all these little bitty tiny bones in there, and right across the top of the wrist right there is a big old flat piece of adhesive tape, or gristle you could say, and that piece of gristle is holding down all of these nerves and all of these veins and everything that run out into the hand. Okay, so now you're going to put that away. We've talked about carpal tunnel syndrome in the past as being related to diabetes, hypothyroidism, being related to repetitive hand micro trauma, like driving the what do you call that thing? Jackhammer. Okay. Now, if you look at this picture, if the numbness is pretty, people are looking at numbness that stops right in the middle of that finger right there and doesn't involve the little finger, would probably tell you their total hand was. Look at that. You would say your total hand was numb, but if you went to the doctor and he took a pin and stuck it on the outside of your little finger, you'd say, "Oh, I can feel that." So I'm going to make the assumption that the guy has bilateral carpal tunnel syndrome. Now show that next one, because we're going to get a little bit more fancy here. Up here in the armpit, when you're watching it, now everybody who watches athletics on television sees a guy go down, wide receiver, cornerback, can happen in baseball or any other thing, and he hits the ground and you say, "Oh my gosh, he may have broken his neck." And they run out on the field and they start doctoring on him and everything, and he gets up and one of his hands is hanging, and the sportscaster says he had a stinger. Stingers? Remember all those? Okay, this is the brachial plexus. That's all those nerves that run out of your arm, and when you hit your head or your shoulder in a collision, if it stretches these things, the whole hand is paralyzed. The arm is paralyzed. It's like somebody's hitting you with an electronic prod, and that can cause numbness of the entire arm. It will not occur just sitting in a car, sitting on a motorcycle, and I don't know of any kind of benign or common condition that would have caused that in both hands. So pull up that last one. There are two whole. Now I'm not going to make you read it all, but if you look at it across the top, it says function,
muscle, and nerve.
There's 4 pages of this: function, muscle, and nerve.
And that I can see where that goes together. The function, muscle. I got it. I actually look at that and I say, I'm watching what you do. I say,
you got that figured out. Okay. Now, all right. This is going to happen. I don't know if it's happened to you or not. But when you're complaining of some issue, if the doctor has got to figure out what function is interfered with,
right,
what distribution does it have, meaning muscle, or as thou showed those pictures there, and then what is there a specific nerve that affects that distribution that you would assume is involved in causing the problem? All right, you still with me?
I'm with you.
All right, you can pull all that off, but there's 4 pages of that, and that's just for the hands. That's not everywhere in the body. That's 4 pages of this just for the hands. Now, I'm a little older. I wake up at night, and if I have gotten over on my back, I can wake up and both hands are numb. We went through this not long ago. Remember when I said, well, shake your hands, it's going to come back. Remember us talking about park bench paralysis? Park bench paralysis is where you get drunk, you put your hand over a park bench, it sits on your arm. If it mashes on that artery long enough to kill the nerve, you're going to be paralyzed in that hand for months. But most often you're going to wake up and that arm won't move, and then over the course of the next 30 minutes or so it gets straight back and it will work. So this guy in this automobile, I haven't got any idea. He's got a brain tumor. He's got nothing wrong with his neck. He's either got bilateral carpal tunnel syndrome, or he's sat there driving his car without doing this often enough to allow the blood supply to get in both hands. If he's got bilateral carpal tunnel syndrome, he's riding a high rider, which has got his hands here on the motorcycle instead of here, and he's got his hands on the steering wheel there. And what can he do to make it better? Move your hands.
Let me ask you a question.
Wait a minute. If it happens not in the car and is in both hands when you're doing this, go see your doctor. You need an injection.
All right, we're talking about hands, so we're going to talk. Now, it's not bad, but let me just say this. I'm going to say from time I was 19 to 25, I'll put that as the window, okay? Now, DeWalt, Milwaukee, Black & Decker, Makita, all of them, they made screw guns where they fit right in your hand. And on a daily basis, I did this with screws. I could go that like that.
Yeah.
I could go
You're
like
the fastest guy on the wharf.
You got it, man. I could take a handful of screws and roll them and do that. And now I don't have grip. I don't have the grip. Every once in a while, this hand will just do this and stop. I gotta do this, but it's not bad. But I mean, is that something from that time?
I would think not.
Okay. Because
that should have happened pretty much then. I think it may have to do with your weight.
What the?
Well, wait a minute. You just asked me the question. Well, wait a minute now. Let's go back. Where's that picture of the wrist?
Okay.
Now, we just got through showing you this picture of the wrist.
I asked for it. What am I going to do?
Just the first picture.
If I don't want the answer, don't ask the question. Go ahead,
first picture, okay? All right. There's that tight gristle right there. Remember that?
Yes, sir.
Okay, I said we first talked about this as being resulting from diabetes,
right,
hypothyroidism,
right,
both of which cause you to gain weight, and you deposit fat underneath that gristle, and therefore it's like park bench paralysis, but it's caused by fat, and you got to get the weight off or inject it with cortisone to stop the inflammation. Now, we've talked about sleep apnea. We've talked about snoring. Remember that?
Yeah.
Okay, it's that same gristle that's around your throat. You'll remember that in the Kung Fu movies, the guy goes clunk like that and the guy dies. Well, why does a guy die when he goes clunk? He didn't break anything. Do you remember the discussion?
Yes.
Okay. Do you remember, Josh? Okay, so if I hit you in the eye, your eye can swell out to there with a big old bruise, right? Black eye. But if you get only a small bit of blood that big around in your brain, it can kill you because your skull can't expand, right? And that little bit of blood pushes on the brain, pushes your spinal cord down here, and you die. So what happens here makes you snore, get sleep apnea, is that gristle that's up there where when the guy hits you, you bruise into it, it cuts off your carotids and you die, the carotid chop. What's happened to people when they gain weight is they get fat inside the gristle, then they can't breathe, and they go and they die. Well, that's the same thing in your wrist. So let's go back. I think you need to lose weight and the wrist will get better.
Oh, so that could be the reason why I can't, my weight could be the reason why I can't open a jar of jelly. Because I don't have
I got it.
Okay.
Boy, I tell you, I am brutal, aren't I? I am absolutely brutal.
No, you're okay, man. You are
All right. Well, I didn't ask for that.
You are totally okay.
You opened that one up.
I can take it.
All right,
I got to get on to talking politics. I may feel.
You want to talk about? You want to go back to talking about the measles epidemic and the shock?
Like that. Let's talk.
All right. I want you to look at the news of the week.
That's what we're getting at.
All right, now look at this. This is the exact way they came out this week. Heart failure hospitalizations spike when flu season peaks. So the people that don't want to take a flu shot, just think, a flu shot may stop you from going into heart failure. But if you just go here, the next one, this one's on sleepless nights. The second one's on sleep. Things that are being marketed for sleep, and three of the top five are about I discussed this a couple weeks ago. The amount of sleep recommended for people in our age group is 7 hours and 45 minutes to 8 hours and 15 minutes, and only about 12 to 15% of people are getting that much sleep. Now, there are 70 million American adults. So you think we got, what, 321 million or something in the United States? What, adults are probably 200 million of that. 70 million is almost 1 in 3 have significant insomnia or sleep issues. And that's why that guy has 10 ads on Fox about the pillow, my sheet, he got 3 ads, my pillow, my sheet, and my mattress cover.
Right.
And you just think if you buy something from that guy, you're going to sleep better.
You sure do.
Yeah. Then you go over to another channel and they got melatonin and they got this sleep aid, Mm-hmm. And so it's a huge multi-billion-dollar business. Now, what's the definition of I can't sleep? Give me a definition. 3 nights of difficulty either falling asleep or staying asleep, 3 nights per week for 3 months or longer. So if you're not sleeping because your daughter's going through a divorce, or you're not sleeping because of some illness or something, it ain't going to work. It ain't going to last 90 days. But once it's last 90 days, you have to identify what's going on. Well, 60% of that stuff is either sleep apnea, which is associated with heart disease and diabetes and early death, chronic insomnia, which is a sleep disorder on itself, but needs to be diagnosed. You don't need to buy the My Pillow, the My Sheet, or the My Mattress cover from that guy on television, although I really admire him because he's almost always supporting Fox TV with his ads. So anyway, that's the big thing.
I know what you're saying. Yeah. I mean, if you want his products, buy his products so you may enjoy his products. But don't buy his products anticipating that it's a solution.
Yeah, right.
Did I get that right?
That's exactly right.
Well, I'm not sleeping well, but it must be my weight or something. And
it is because of the
no, I didn't. I actually wasn't going to ask you to. Oh my gosh! I tell you what, I enjoy this, but don't forget, folks, thank you, Georgia Cancer Specialist affiliated with Northside Hospital. But don't forget, you can ask the doc a question. And what you do, you send it to info, I-N-F-O, at fetchernews.com. Put in the subject line, ask the doc. And we'll get the questions to Dr. Whaley, and we may get your question on the air here on Fridays. Also, if you would like to go back and send these segments, there's so many. I mean, we have covered almost everything every week in full detail. So you go to our YouTube channel, FYN TV, Fetcher News, click on the playlist, and you can just keep scrolling through, share them with your friends. Again, thank you.
Okay, wait a minute now. I got a couple more.
What you got, sir?
Okay. I don't want to get on a soapbox here, but the CDC is to start tracking ticks
as
disease vector. Okay.
Right.
You remember last year at this season, the season before, we were talking about what's that disease we just talked? Anyway, the epidemic that was going on in Central America, Zika virus.
Mm-hmm.
The tick-borne illnesses went up last year by about 200%. And you got that one that makes you allergic to meat, and you got deer tick fever and all the rest of them. It's gotten to be such a problem that I would say for people up here in the mountains, you're going to need to start getting right now your mosquito repellent tick stuff out. You're going to need to go out in your yard and make sure all of your water that's in the tires and everything is turned over, because the mosquitoes are coming up. And they anticipate a pretty good epidemic this year of tick-borne illness. We've always talked about mosquito-borne illness, so think about the ticks around your house. There you go. Now I'm through.
That's fine. Ask the Doc, Dr. William Whaley. Again, thank you very much, Georgia Cancer Specialist affiliated with Northside Hospital, for our segment today. We're going to take a brief break, and it's time for the All-Star panel. Yes, Bruce is here. I questioned that earlier. Now, I'm going to put him on the spot. I sent Rick a message yesterday. I said, Rick, is the whole gang together? He don't answer me. I don't know what he's doing, you know. So I told you this morning.
He was reading the emails I sent him.
The emails you sent,
that you didn't read.
Got it. So I didn't know if Bruce was going to be here, but he will be here. And I'm for sure he's got something in the orange folder he wants to share with you right on the other side of this break, the All-Star Political Panel.
And Keith is the guy that's watching, right?
Keith, yes.
Thank you, Keith.